started. Okay, so we're now live on YouTube. Good morning, everyone. It's Tuesday, July 14th. Thank you for joining us for today's media briefing. Today, we will have updates from Dr. Julie Wang and Chair Karen Redman. I will be providing the enforcement update as well. So let's get started with Dr. Julie Wang. Go ahead, Hsiu-Li. Do you need me to unmute you? Oh,
sorry, is it working now?
It is.
Okay. Thank you. Okay. So I'm going to start today with Determinants of Health update. So 2 weeks ago, we released our neighborhood level data. At the time, we did an initial analysis that did not show any visible patterns of correlation between cases and some determinants of health indicators that we produced by neighborhood. The most obvious pattern was the influence of long-term care, home and retirement home outbreaks on the distribution of COVID cases in the region, which were also quite influenced by the testing limitations that were in place at the time. We have since completed a more in-depth and statistical analysis of our neighborhood level data and have determined that there is a moderate degree of correlation between COVID rates at the neighborhood level and recent immigration status at the neighborhood level. And to a lesser degree, some correlation with low income. So we also analyzed the relationship between COVID rates at a neighborhood level and the proportion of the population that is a visible minority at the neighborhood level. And in that case, we did not find a correlation. That map of proportion of the population that is a visible minority will be uploaded to our website later today. So although these results indicate that there is some correlation between recent immigrant status and to a lesser extent low income, they do not fully explain the complex relationship between determinants of health and COVID-19. There are many factors that influence COVID-19 incidence rates, and not all neighborhoods with low income or with higher proportions of immigrants have higher COVID rates. It's important to note that these results do not necessarily indicate an increased risk of COVID at the individual level. So for example, recent immigrants are not necessarily at increased risk of COVID. And finally, it should be noted that correlation does not equal causation. So this does not mean that living in a neighborhood with a higher proportion of recent immigrants, for example, causes increased risk for COVID. That's important to point out. That's not what we're saying here. But there is some degree of correlation. And so these results are not surprising, and they're actually consistent with what's been found elsewhere more and more now across Ontario. We know that social economic factors or social determinants of health affect health in many ways. So our local results support growing body of evidence that there are associations between COVID-19 and social demographic factors. So what we need to do going forward is we need to continue to monitor. And once we have individual level data, we will explore additional analysis that may help increase our understanding of risk factors, and we will be ready to collect individual level data on race, income, language, and household size among COVID cases starting this week. If I go now to overall trends, so the overall status of COVID continues to move in the right direction. As of our dashboard refresh at 10 a.m. this morning, we have 49 active cases in the region. A total of 41,915 tests have been performed, with positive results for approximately 3.2% of all tests. A total of 1,179 cases, or 88% of positive cases in the region, are now resolved. As of this morning's update, there is currently one outbreak in a long-term care home setting. There are no outbreaks in retirement homes, workplaces, or congregate settings. Yesterday, we reported another COVID-19 related death in our community. I wish to extend my sincere condolences to the family and loved ones. We know that COVID-19 continues to circulate in our community, and this is a reminder that it can cause serious illness and death. So yesterday we learned that the region will move into stage 3. As of this Friday, we are able to move to stage 3 because of your efforts to date. But we continue to have a collective responsibility, each of us, to do what we can to continue to slow the spread of COVID-19. We must continue to protect each other, and we must move forward with the utmost vigilance. On Friday, the size of gatherings will also be expanded. For both indoor and outdoor gatherings, we must maintain physical distancing between ourselves and anyone outside of our social circle. Social circles or bubbles remain at a limit of 10. These are the people you can interact with physically and are also known as your close contacts. So our new normal of physical distancing, hand washing, wearing a mask in indoor settings and on transit will remain even as we move forward. All residents are reminded that face coverings are required in enclosed public spaces and on transit by the Region of Waterloo bylaw unless you are exempt. A face shield is not a substitute for those who can wear a face covering. A face covering helps to contain your respiratory droplets. A face shield can protect you from other people's droplets, but it does not contain your droplets. If you would like to wear a face shield, you must also wear a face covering that covers your nose, mouth, and chin. For those who cannot wear a face covering, a face shield is better than no covering. So in conclusion, I would like to thank everyone for their efforts. Let's continue to protect each other, and thank you.
Thank you, Hsiu-Li. We'll now hear from Chair Redman. Go ahead, Karen.
Thanks, Julie. Yesterday, the province announced phase 3 of reopening starting this Friday. Our region was again one of the 24 areas allowed to enter phase 3, which is very encouraging news, as this means most of our economy will now be open, with safety measures and some restrictions in place. Some phase 3 changes include allowing restaurants to offer indoor dining, personal care services, reopening performing arts centers and theaters, reopening the childcare centers and outdoor playgrounds, resuming team sports and live sporting events, opening bars, gyms, and tour services. At this time, we're anticipating guidance from the province regarding to the reopening requirements for these businesses. So those who have questions about the guidelines for reopening should visit the province's website. Although this is a much anticipated time for businesses, I encourage businesses and services not to reopen until they can do so safely. I also want to add that although many more businesses will be open as of Friday, there remains a small percentage who are not yet permitted to open. As a region, we need to continue to support these businesses through our behaviors in the community. We need to continue to contribute to flattening the curve by following all of the recommendations from public health. Don't leave these businesses behind. Entering phase 3 is a result of the hard work of our healthcare staff, frontline workers, support workers, and citizens who followed public health guidelines through COVID-19. Thanks to all of you for your diligence and for your patience. With more businesses opening and outdoor gatherings of up to 100 people being allowed starting this Friday, I want to stress the importance of continuing to practice public health guidelines. The fact that our face covering bylaw started yesterday will be extremely important, as indoor gatherings will increase up to allowing 50 people. The region's GRT staff are giving out free masks to transit riders, and I understand we've already distributed 2,000 masks. We must also remember to continue to stay 2 meters apart, wear masks when we're out, wash our hands thoroughly and often, and try not to touch our faces. Social circles will still remain at 10 people across the province. We've come a long way. However, we don't have a vaccine. We are still in a pandemic, and catching COVID-19 is still a risk. Please continue to practice public health guidelines and keep us moving in the right direction. As businesses work to reopen or to enhance their services, the region is hosting 2 events this Thursday, and I encourage businesses and stakeholders to participate in them. On Thursday, a panel discussion on COVID-19 best practices for Waterloo Region's restaurants is planned for 10 a.m. Hear from restaurants that have successfully navigated the new pandemic guidelines and ask them your questions. Also on July the 16th, Council's COVID-19 Economic Recovery Committee is inviting all local businesses to share their ideas and feedback with the committee, and that is from 1 to 3 p.m. on how to help rebuild our economy. Thank you.
Thank you, Karen. Okay, so I will provide you with an enforcement update. It is a combined update from the various municipal bylaws, as well as Waterloo Region Police Services, our regional bylaw as well. So we had a total for the week of July 7th to 13th, we had a total of 110 complaints that required activity or follow-up. 92 of those resulted in a need for education and warning, and 18 of them did not require action at all, with 0 fines being issued this week. So that's it for the enforcement update and for all of our updates. So now we'll turn it over to you guys for questions, and we'll start with Kate from CBC. Go ahead, Kate.
Thanks. Dr. Wang, with the information that you provided early on about the look at neighborhoods, what else do you do with that information now? Like, would public health now go into those communities and maybe talk to those residents about testing opportunities, or do more education about what COVID is and how to prevent the spread? And is that a challenge if there's new immigrants who don't speak English?
Thank you for your question, Kate. It's good information for us to have. As I mentioned, it's only, there's only some correlation, so it doesn't mean that a neighborhood that has a high percentage of recent immigrants actually necessarily has higher rates. But if we start to see an increase in cases, it allows us to be more aware of the need to consider perhaps additional approaches to how to make sure that populations like that have the supports they need to get tested, and maybe there's more education and outreach Maybe there's options for mobile testing if there's, you know, a number of them in a certain area. So those are the kinds of things that we would look at, you know, in collaboration with our healthcare partners who do testing. So right now, I know our case rates are relatively low, and so we don't see areas that continue to have a lot of cases per se, but this is still good information for us in terms of monitoring, and with the individual level data that we're going to be able to get starting very shortly. This should allow us to do you know, more analysis that will, I think, provide even further information about you know, what are the risk factors. And of course, you know, if there's whenever we do work with a group, for example, you know, we've worked with groups of workers that were involved in like workplace outbreaks or whatever. We would work with those groups to help them get the supports that they would need.
And so in this case, might one of those groups be like sort of the multicultural center or?
Yes.
Yeah, okay.
Yeah, absolutely.
I have sort of a different question as well. This past weekend, now I'm in Guelph, I will give you that. I went to the dining district in Guelph, saw lots of people enjoying the patios. But there were like groups of 10 people making reservations who I question whether or not they were in a bubble. And how does that work? Like, there was no way they were 6 feet apart from each other while they were eating. Did the rules not apply on patios? I may have missed that part.
I think the restaurants have to put in place measures to enable, you know, groups that are dining together to be 6 feet apart. Whether the people in the actual dining party are all within the same social circle, and I don't think it's possible for, you know, the restaurant to be sure of that or not. So we really ask everyone to take personal responsibility for that, to make sure that if they are with people that are not within their social circle, that they continue to you know, remain physically distant from them, approximately 6 feet. I know that's not easy. I mean, I've been in a social circle, you know, up to the limit where we had to physically distance, right? It's not as fun as when you are closer together, but it's part of the new normal. And so I would just ask everyone to continue to, you know, take personal responsibility for that.
Some people don't really like to take personal responsibility for that sort of thing. So does that kind of behavior concern you about what we might see in the coming weeks?
I think for sure, you know, there's going to be some people that may not follow those guidelines, but you know, they're, by and large, I would say that our community as a whole has been following guidelines well, and I think that's what's contributing to us being in the state that we're in. So that's why we continue really to ask people to do that, and to remind them that now is not the time to let up, especially as we're opening up more and more businesses and activities. You know, that's going to increase the risk. There's going to be more social interaction that's going to increase the risk. So that's why in particular, like, I am really urging that people understand this is not at all the time to let up. If anything, we need to be even more careful and follow the public health guidance. So, you know, we have relied a lot on our community members to follow the guidance, and they've gotten us to where we are today. So we just continue to ask them to do that.
And
I don't know if
Kate,
Chair wants to add anything. Yes.
yeah, thank you, Dr. Wong. And if I could just add, Dr. Wong gave a clarification around face shields. We brought in the mask bylaw as a regional council through a unanimous motion, trying to bring clarity and certainty to people in public spaces. We're being peppered with these kinds of questions. And I think it's an indication that people truly do want to comply. They just want clarity and they want to know what's acceptable, because people that aren't going to comply aren't going to ask for that kind of detail. So I think in general, the vast majority of people, whether they love the bylaw motion or not, are recognizing it's in place and want to know how to appropriately comply with it.
That's a great point. Getting lots of questions.
Okay, I'm gonna leave it there. I have more questions, of course, but see if other people do them.
Sure.
We would expect nothing less, Kate. Okay, we'll move on to Damon from Woolwich Observer. Go ahead, Damon.
Hello, my first one is for Dr. Wang. I was wondering if you could provide us any details of yesterday's death.
Yes, okay. I'm just gonna get my document here. So the individual was a female in their, or over the age of 80, and it was a community death. So it was not related to an outbreak.
Okay, then my next question's kind of a follow-up to Kate's. With the whole data collection, what should the public be getting away from this? And is there any fear for like discrimination based off race or class when this is released?
Yeah, no, I mean, it's always a concern, which is why, you know, I try to make clear what this data is not saying and what people shouldn't take away from it. But at the same time, I think it's important for people to know, you know, we have seen that these types of determinants, such as low income and other social determinants, affect a number of health conditions. This is not a new thing. You know, what we've noticed with this more in-depth analysis is there is also some suggestion that this is likely also the case here, at least for some of the factors we've looked at. So this just helps us identify groups that may be at higher risk. And it helps us in terms of being mindful of the potential for increased risk, and to think of ways that we can try to mitigate the risk given these, you know, given the fact that they may be at increased risk. But these are also, you know, factors that go beyond public health interventions per se. You know, they, as I mentioned, the social determinants affect a range of health conditions. And so they just, I think they just add to the body of evidence that, you know, work needs to continue to be done to try to address the inequities that we see in our society. And so that kind of work needs to continue.
Okay, and then would the same breakdowns relate to high density of population in those regions?
Yeah, we don't have that analysis, but I think what we've seen in other health units, like in Toronto, for example, you know, I think that may be something they've been able to see. It's not so much, I think, the density of the population within a city. It wouldn't really be that. It would be, you know, the density in one's sort of immediate environment. So if, example, you are living in a household with a lot of people or a lot of other people, sorry, let me say that again. You're living in a household with a lot of other people, or you're living in a crowded household environment, that could definitely increase your risk. And we know that happens regardless of what your immigration status is, if you've been born and raised here or not. If you're in an environment like that, that's going to increase your risk. If you have COVID or someone in your environment has COVID, it's possible that there's a greater proportion of people who have recent immigrant status, for example, who may be, in lower paying jobs, in higher risk settings, such as healthcare settings or essential work settings. They could be living in environments where there are more people or it's more crowded. So that could lead to an increased risk. It's a complex interplay. It's not just one factor most of the time. It's usually a complex interplay, and I think it just reinforces that there may be some groups that are at greater risk because of the types of risks that we know we are all susceptible to, such as close contact with others.
Cool. Do I have time for one more question?
Sure,
Okay.
Go ahead, Damon.
I think this is for Karen Redman. So we're expecting an influx of people to come out to like bars and venues when stage 3 hits. Where will the enforcement be on those group counts of 50 people indoors and like lineups down the street? The streets are going to be filled up. What's the region's plan to deal with this?
So we will have I feel like I'm channeling Mike Murray here, even though he's retired, right? So we will have area bylaw, we will have regional bylaw, we will have public health inspectors, as well as we will have Waterloo Regional Police. What I think most of us find, Damon, is when we go, businesses have been very proactive in putting up a plexiglass where it's appropriate, putting lines where they've measured people need to stand so they're 2 meters apart. It will be businesses in a large way, making sure that they've made those accommodations, that they can demonstrate, whether it's an outdoor patio or inside dining, that they have indeed followed those guidelines. So those things still continue to be important. The onus will be on the businesses to have accommodated that. And again, enforcement will be about education, talking about the guidelines, and cooperation unless somebody's really recalcitrant and continues not to respond to that overture. So as you saw over the last weekend when Julie gave up her update, there were no tickets written because we really are trying to be proactive. I think everybody recognizes that about 90% of businesses will be able to open in phase 3, and that's wonderful news. And we're really confident that they will look at the guidelines and try to adhere to them. We also have to look at the businesses that aren't part of that group and help working with them, because they need to get plans in place to open up, because we don't want any business left behind. This has been a very difficult economic time for them and for all of their employees.
Thank you so much.
Thanks, Damon. We'll move on to Tim from 570. Go ahead, Tim.
Hi, Tim.
Good morning. So Chair Redman, with Waterloo Region heading into stage 3, with the Economic Recovery Committee and with the information from the federal government about their deficit, how has the pandemic impacted the region's deficit, or how will it impact the region's deficit?
So right now we are looking at a deficit projection by year end, Tim, that is probably around $17 million. And I'm chair of MARCO, which is the mayors and chairs of Ontario. And I know that colleagues in Ottawa and Hamilton were talking about $120 million deficit. And I know that London, I just talked to the mayor this morning, and they're in double-digit millions of dollars of deficit too. And it really, transit has been the huge lost funds. So that has been really, when we continue to provide public transit throughout the pandemic, that has been the probably single hardest hit to our budget. So as we go forward, we are looking at having that kind of deficit at the end of the year, projected on the way people have used transit, the costs have gone to date. And as you know, municipalities can't budget for deficits, so we will have to figure out how we deal with that in the next fiscal year.
And with the next meeting coming up, will stage 3 change the agenda in any way? And will stage 3 help remove red tape for businesses?
So I would tell you that that is really the focus of the economic recovery task force. They're looking at those things. I think the town hall, when they're talking to businesses and listening to their questions, will be very, very important. Whatever comes out of that economic recovery pandemic task force will be fed into the budget process. So we're hoping that in real time, we can cut down some of that red tape when it's identified, and as we go forward, that there will be recommendations that can be considered by all of council when we look at the budget for 2021.
Okay, and Dr. Wang, do you have any other information about the outbreak in Cambridge?
Oh, in the long-term care home?
Yes.
It's just one staff person at this time.
Okay,
Yes.
and do you know if Cambridge Memorial Hospital is helping out in any way, or is there any other information on that?
No. At this point, it's just one case, and there isn't a need for additional supports for this home.
Okay, those are all my questions. Thank you so much.
Thank you, Tim. We'll move on to Joanna from the Record. Go ahead, Joanna.
Thank you. A couple questions first about masks. What are your impressions so far? I'm not sure if this is for Dr. Wang or Chair Redman, just about what you're seeing out in the community, or what you're hearing about the mask bylaw and how many people are wearing masks.
So I would reiterate, I'm going to have to look at my note. I think it was 2,000 masks that were handed out on public transit, Joanna, and I think that speaks well to people wanting to comply, and that was always been an important place where we knew that physical distancing wasn't always possible, so it was really important they wore masks. Again, I would tell you that all of the emails, the questions and phone calls that my office is getting is people trying to clarify how they can comply. So I think that really bodes well. And I think people really appreciate the fact that we're part of the first 24 areas that are going into phase 3. It is good news for people who want to use those services and visit those attractions or restaurants. It's good news for those businesses. And we really want to keep underscoring that that's because as a community, we have been very diligent about following the public health guidelines. COVID-19 is still in our community. People need to keep being reminded of that. But as we go forward, we anticipate compliance because that's been the track record to date. I don't know if Dr. Wang wants to add to that.
Yeah, no, just a little bit. I mean, I've been also hearing a number of anecdotal sort of observations from others, and you know, myself, what I've seen reflects what Chair Redman was saying, which is that I think we've seen a good uptake amongst our population of mask wearing in those settings. So I'm happy to hear that. It sounds like we're off to a good start. And I really appreciate the fact that residents in Waterloo region are taking this seriously and trying to comply as much as they can. This is really going to, you know, be good for us. And so, I mean, I'm sure council is very happy about that as well.
And there have been reports of exemption cards circulating about, like, basically saying that I have a disability, I don't need to wear a mask. Is that something that you guys have seen here locally? And what would you want to say just in general about those cards?
So I personally haven't had that question posed to me or seen that, but I would just say that people do not need to prove their exemption status. You know, they should be taken at their word, whether they are exempt or not.
And Joanna, I would tell you that that was an active topic of debate amongst council when we crafted the bylaw, and council unanimously felt very strongly that no one should have to prove or demonstrate that they had a disability or an exemption. So that's certainly not been anything that we entertained as part of our bylaw. There were cards being handed out, or people talked about bracelets, and we said that is absolutely, the onus should not be on the individual. They should be taken at their word. And we really again, just stressing to people to be kind to other people. Assume if somebody is not wearing a mask, it is because they have a medical exemption. They should not be challenged by businesses, although businesses do make their own rules. So there are some businesses, even before our municipal bylaw, who insisted people wear masks. And then the patron has the option of either accepting a mask or taking their business elsewhere. So some larger corporations had already made that decision, but our bylaw does not request anybody to prove that they have the medical exemption.
Okay, thank you. And a question about moving into stage 3. What are your concerns or maybe cautions to the community as we take this big step?
Well, maybe I can start. This is a big step, Joanna. And, you know, I know we welcome this, but we have to be extremely careful. As a community, we have to not take this sign as a sign that the risk of COVID has gone away. We need to take this as a sign that we've done a very good job, and we need to continue to do the things that we've been doing in order to allow us to continue to move forward. And as Chair Redman mentioned, eventually, you know, have all businesses reopen. It is definitely a very big step. Personally, I'll be honest with you, I'm a little bit afraid because there's going to be a lot more social interaction. But I am also encouraged by the fact that, you know, residents in our region have been very responsible. They've followed guidance. They've brought us to the stage that where we're at, and so, you know, I'm also optimistic that we're gonna be able to continue to on the right track. So yeah, but you know, that's why I'm a little bit of a broken record, and I keep reinforcing how important it is for us to remember that we need to continue to practice those same public health recommendations that we've been giving for a while now, and to just consider them as our new normal.
And Joanna, if I can add, when to the businesses that I've talked to, this opening at this juncture in the summer is really important for them to try to recoup some of the economic losses that they've suffered over the last 3 or 4 months. And the last thing they want to see is us to revert back to a lockdown and go back to phase 2 or even phase 1. And as you look at the next several months, they're now looking at September, October, November. So they're taking a long view. They talk about, you know, the employees they have that have been laid off and the fact that they are now able to come back and work. So they're looking at this, I think, from a business perspective, that they will be very compliant, that they will ask their patrons to follow that public health guidelines. And it's a really important step, but it does come with risk, as Dr. Wang has said. So I think businesses will be very keen to make sure that they're doing everything to keep community spread low so that they don't have to revert back to clamping down and maybe laying off their staff again.
Yeah, maybe my word afraid was a bit too strong. I mean, my English is not always perfect. Trepidation, I have some degree of trepidation. Maybe a better word.
Fair enough. Those are my questions for now. Thank you.
Thank you, Joanna. We'll move on to Irene from Air News. Go ahead, Irene.
Hi, I'm not sure who my question is for, but it's concerning mobile testing and wondering if mobile testing will come to the townships.
I think the strategy that the assessment centers who oversee testing in general, they have employed is to you know, try to take a look at what best suits the needs of the community overall, given the resources you know, that are available. And as we are aware, you know, testing resources have increased. You know, there's there's 4 testing sites. There's a drive-in, or rather drive-through right now as well. So, you know, they monitor that in terms of access, and they'll sort of determine in what situations mobile testing makes more sense. So, for example, when we had a lot of testing going on in long-term care and retirement homes, you know, they brought mobile teams to test in those homes. It does take more work to put together, you know, mobile teams, you know, to have them available to quickly be deployed. It's not insignificant in terms of coordination of efforts and staffing. So we need to deploy them when it makes most sense. If people can easily come to assessment centers, for example, you know, it wouldn't make sense to do that. There can also be times when we arrange, you know, some predetermined times where testing is available somewhere. But again, it would depend on the needs and whether we think that would, you know, be the best use of resources at the time.
Thank you. Has there been any surveys to see what percentage of people from the townships are being tested? I would say locally that I think it's very low, and it could be because even in terms of air, it's a half-hour drive to get to the Cambridge Hospital or Kitchener. So, you know, wondering if our low numbers are really a reflection of low testing.
So, you know, testing is recommended for people who have symptoms or people who feel that they've been exposed. So those really are the key groups that testing is targeted for. So it's not necessarily, you know, exactly whether or not you know you live in a particular area. So, you know, that would be what I would continue to recommend, that you know, people who have symptoms or who feel that they may have been exposed are the ones that seek testing. Of course, anyone can have a test; no one will be turned away.
Okay, thank you.
Thanks, Irene. We'll move on to Nicole from CTV. Go ahead, Nicole.
Hi, this question is for Dr. Wang. It's in regards to your data collection. I was just wondering if we could just perhaps dig a little deeper to discuss some of the already pre-existing health conditions that some of those people in those communities already have. You know, are you talking about things like diabetes and whatnot in those communities? Are you able to provide some of those health conditions that you had talked about earlier?
No, we don't have that type of analysis. We know that, you know, we already know with COVID that if, you know, you have health conditions, you are at greater risk of having more serious outcomes with COVID. This analysis I talked about was really looking at things that are emerging more as additional risk factors that we don't have that much information about, but that we're starting now in the last few months to get more information about, right? Which is the relationship between social economic factors and, you know, rates of COVID. Again, this is a neighborhood level analysis, so it has limitations for sure, because you can't attribute risk at the individual level. You can't say because, you know, you have low income or because you're a recent immigrant, you are at increased risk. It just means that in certain neighborhoods where there are more recent immigrants or there are more people with what's considered low income, there are for some of these neighborhoods higher rates. So it's a very indirect measure, but what it does is it just adds to the body of evidence we've seen now in the last several weeks. I would say the more analysis that has been done, it's easier to do it when you have greater numbers of people. So for example, Toronto Public Health has done that analysis. Public Health Ontario has done the analysis because they have Ontario data. So those results that we've seen are similar to, or rather I should say, our results within our geography, which is smaller, are by and large in alignment with that trend that we're seeing. So it's really that. It's really looking at those things that we don't have that much evidence for at this time. Yeah, so I would say, yeah, that's what it is.
And I guess my last question, my colleague, he was out and about getting visuals, and he saw one individual get off the bus, presumably because he didn't want to put on a mask because he was yelling as he got off the bus and he was not wearing a mask. Are you guys taking a tally in terms of how many people are not complying and being asked to leave? And are you aware of any instances of, I guess, any businesses asking people to leave, or where people have refused to wear masks?
So anecdotally, I have heard people that have gone to large stores that previous to our bylaw were saying masks were mandatory and have said you have to wear a mask or you can't come in. So I would say anecdotally, Nicole, that's been happening all the way along. As far as enforcing it and mandating it on public transit, there is a whole regime right now where we have people riding the trains and the buses that already look for people through their code of use, whether or not they are behaving appropriately, they're being respectful. So all of those statistics already are being taken. I haven't heard of any in particular. I mean, the mask bylaw just started yesterday. Those statistics will be easy enough to take. The scenario that you've talked about makes several assumptions. They may or may not be correct, but certainly the enforcement on GRT specifically, the mechanisms are in place to have that happen, as are any of the other requirements for people who want to use public transit. So it's early days. We're trying to use education and moving towards compliance. So we'll continue on that tact at this time.
Okay, that's it. Thank you.
Thanks, Nicole. All right, so we've gone through round one. Now I'm looking at you, Kate. Do we have any further questions that you'd like to ask? Go ahead, Kate.
Thank you. Chair Redman, I just wanted to confirm that $17 million deficit that's projected, would that change with the anticipated federal funding?
I would be thrilled to be able to tell all of you that the federal funding came through. We're looking for, through the FCM request for $4 billion for municipalities in the province of Ontario. And that's what we continue to lobby for. So yes, that would be very helpful. And we're also looking for a specific stream that would be targeted for revenue losses for public transit.
So with that $4 billion for municipalities, would the Waterloo region share of that cover that 17 million?
You know what, it's a hypothetical question, Kate, only because we don't know how they're going to allocate it. Are they going to use the same mechanism they do for gas tax? Are they going to do it on population? One of the reasons I mentioned statistics and other municipalities is they're several quantums bigger than what our loss is, but any kind of loss is really difficult to recuperate from when you're a municipality. So those are all unknowns. Those are all things that we continue to lobby both the provincial and federal government to get answers for.
And Chair Redman, I understand that this is kind of a stalemate between the province and the federal government. When we talked to the federal government last week, they said, we need the province to agree to stuff. The province said, oh no, the federal government has to provide it. So with the Premier being in our region today, is there any message to him to maybe get this money flowing to municipalities?
I would have to tell you the Premier's been very clear that he feels that he's fighting on behalf of municipalities, but I would also agree that I do think it's a bit of a standoff between the provincial and federal government. So the longer it takes, the more money we're losing. And again, One of the reasons why there was that press conference with John Torrey, Lumco, Marco, and AMO just about a week ago was because this is the time that we are now crafting the budget for 2021. So now is the time when we need to know what help is coming and how it will be allocated. So time is of the essence right now. And so I guess that would be my message to the Premier. Time is of the essence, and we really are looking for partnership in being able to handle the ravages of this pandemic.
Great, and I just had one more question for Dr. Wang. With stage 3 and playgrounds, my kids are going to be very excited, but do you have any tips or things parents should be keeping in mind? I know with community gardens, like hand sanitizer stations had to be at the playgrounds and stuff, or they could opt to bring soapy warm water in a thermos or something like that. Is that maybe something parents should be considering as well?
Yeah, I think if they can think for their families, what they can do to continue to practice the public health recommendations as a family, including social distancing from other families, maybe waiting longer to, play at a certain station if there's lots of other kids or families. That would be good, right? And the municipalities would look after whatever requirements that they have to put in place to try to, maximize safety measures at those playgrounds. So just to continue to think about the things that they themselves can do to help keep their family members safe.
Okay, now I'm really done. Thank you.
Thanks, Kate. Does anyone else have any questions? Show of hands. Okay, I'm not seeing any hands. So thank you everyone for joining us today. This concludes our media briefing. And just a reminder that we will not be holding a briefing on Friday, so we'll see you back here on Tuesday. Take care, everyone.
Okay, thank you.